Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host. So we've got a great webinar coming up in the next hour, and we're going to be talking about fatherhood during the COVID-19 pandemic. And I'm especially pleased to welcome our four presenters. So we're going to be hearing from Dr. Tova Walsh of the Sandra Rosenbaum School of Social Work here at the University of Wisconsin-Madison. Daryl Davidson, who's the director of the Milwaukee Fatherhood Initiative and the Community Engagement Director for the City of Milwaukee. So he's a busy guy there. We're going to hear from Derek Miller of the For Dad Fatherhood Initiative of the Department of Health and Community Services in Kalamazoo, Michigan. And then Shauna Lee of the University of Michigan School of Social Work will be our final presenter today. So I just want to thank all four of you for being here. So this webinar is part of a series of webinars on fatherhood issues that we have co-produced with Wisconsin Child Abuse and Neglect Prevention Board. And so if you're interested in other topics related to fatherhood programming or the role of fathers in children's lives, we've got a number of videos, and you can find those on the IRP YouTube channel and also on the Prevention Board's resource library. So you can check those out there. So I also want to acknowledge the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their partial support of this webinar series through their funding of IRP as the National Research Center on Poverty and Economic Mobility. So today we have an hour, and our presenters are each going to take about 10 minutes, and then we're going to save the final 20 minutes at the end for some discussion, which will address some of your questions that you submitted during registration. And then we also have the Q&A box open at the bottom of your screen, so we're going to get to as many questions as we can before our time's up. You'll also notice that we have the chat box open, and so you're welcome to join the conversation that way. If you have things that you want to share from your own work or just other resources, absolutely feel free to type those in. We do have closed captioning enabled today, and so if you want to toggle that on and off at the bottom of your screen, if that's useful for you, that's available there. So we are going to be posting the slides and a recording of the webinar, and I should have that out by tomorrow, so you can watch for that in your email. And we'll also post that on the IRP YouTube channel, and again on the Prevention Board's resource library website there. So with that, Tova, Daryl, Derek, and Shauna, thank you again for being here. Tova, I'm going to turn it over to you now.
Thanks so much, Dave. Before we get started, just a big thank you to both IRP, the Institute for Research on Poverty, and the Wisconsin Child Abuse and Neglect Prevention Board. It has been really terrific to get to do a series of these father-focused webinars in partnership with both organizations, and I am really excited about today's topic and the terrific co-presenters who I will get to be speaking with. So thanks to all of you for joining us. So here's our plan for today. We've got 4 talks by each of the presenters. As Dave told you, the order we're going to go in, I'm going to be speaking first, then Daryl of the City of Milwaukee Fatherhood Initiative, then Derek from the For Dad Fatherhood Initiative, and finally Shauna Lee from University of Michigan School of Social Work. You can see the titles of our talks listed here, but basically we're each going to be briefly presenting on either research or practice experience with fathers during the COVID-19 pandemic. I think you're going to see a lot of great overlap and intersections between the 4 talks, and then we're looking forward to discussion and questions and answers with you all at the end. So what I'm going to be talking about, I've given this talk the title, "The Pandemic Made It Impossible: How the COVID-19 Pandemic Has Shaped Father Engagement and Well-Being." So in my research, I've been hearing about both things that the pandemic has made impossible and things that the pandemic has made possible for fathers. So we're going to talk a little bit about both, and I'm going to very briefly in 10 minutes present some findings from actually 2 different studies related to fathers in the pandemic, because I think the 2 together really highlight some of the disparate effects of the pandemic on fathers in different life situations. So the first study that I'm going to briefly report to you on focuses on the experiences of expectant and new fathers early in the pandemic. So this study actually, we weren't speaking directly to fathers in this one. The next one was directly with fathers, but the data that I'm going to be telling you about here comes from a study where we did interviews with mothers who had babies in 2020. And we talked to them about their own experiences and also about their partners' experiences and their relationship surrounding pregnancy and early parenting in the time of COVID-19. And so what I'm focusing on today is some of the themes related to fathers' experiences, father engagement and perinatal health services, fathers' mental health and well-being. We did some thematic data analysis looking for themes in these mothers' interviews related to their partners' experiences, and I'm going to tell you a little bit about what we found. So, and I should also have mentioned, sorry, that with this particular study, the sample was predominantly married or partnered, majority white, about 2/3 were white, and the families had relatively high levels of education and income. And in these families, what we found, some of the themes, one was that fathers had new opportunities to spend time with their partners and infants, expanded opportunities. Some fathers who wouldn't have had leave due to work from home had more time at home with their partners at the end of pregnancy or in early parenting. And mothers talked about this time for fathers as being both meaningful and stressful. So they talked about how incredible it was to have this bonus time together, but also how this time was happening in a context, of pretty tremendous stress around work transitions, around fears related to health and safety in the context of the pandemic. We'll get a little bit more into that later on, but this time was really pretty profoundly stressful, including for families with older children, also managing virtual schooling and so on, at the same time as having a new baby and losing a lot of support that they had anticipated. The second theme related to service engagement. So across the board, mothers, and I should mention in this sample, the 60 mothers who were interviewed come from all across the country. They talked about much less opportunity for their partners to be present and participate in prenatal and pediatric care, and how that was a loss for fathers themselves and for mothers who had wanted to participate in these services together, as well as talking about reduced access to supportive services. So fathers who might want to or have had already been receiving services from, for example, a therapist, finding a lot of access cut off as offices were closed and things went virtual, and sometimes that worked well for people and sometimes it didn't. But various services that fathers might have wanted for their own physical health, for their mental health, became difficult to access. And then third theme had to do with paternal well-being. So mothers talked about how this time was profoundly stressful for everyone. Not surprising, I'm sure, to everyone here who's also living through a pandemic, but talked about some very specific new and amplified stressors for fathers, heightened family responsibilities, financial pressures, lots of losses and worries about loved ones with COVID, as well as reduced social support and increased isolation. So mothers talked about fathers that anticipated having time with friends, being able to check in with peers, and how a lot of that disappeared due to lockdowns and other restrictions that either were in place as a result of policy or of family choices about how to keep safe and mitigate risk. So just to offer a couple of examples, quotes from this data to kind of illustrate what I've just said here. This relates to father involvement. The mom says, when we got home from the hospital, all of the caregiving that we had expected my husband to do was like tripled, quadrupled. It was just, we expected my mom and best friends to come, lactation support. And when we got home from the hospital, he had to do everything, right, that he really hadn't expected to do, and I hadn't expected him to have to do. He stepped up in ways that neither of us would have ever dreamed that he would have done or had to do. And this was a really strong theme throughout the data, lots of stepping up from fathers of necessity in a time when mothers did not have the breadth of support that they had anticipated from other people in their lives in addition to their partners. Service engagement theme. So one mother says they only allow one adult, so he'll come and sit in the parking lot. He was disappointed that he couldn't go because it's it's part of parenting. I think he wanted to feel like he was involved. A lot of talk about how what a loss it was for dads to not be able to attend those visits. And then finally, paternal well-being. When the pandemic hit and him not being able to go back to work, because they shut down, I think it was really hard for him. He really struggled with coming to terms with fatherhood. I felt like if he could have left the house and have more alone time to figure out his new identity and, feel like he's more than just a father at this time, it would have helped. He developed postnatal depression for fathers. So talking about all of these changes coinciding, coming together at the same time as transition to fatherhood, and in this case, first-time fatherhood, there was also a loss of employment and how difficult it was to have those things come together. I'm going to move briefly to just tell you a little bit about some findings of another study, just to highlight the range of experiences that fathers have had during the pandemic. And so with this second study, this focuses on the experiences of fathers with low income and less than full custody of their kids. And this research is ongoing in partnership with Daryl and the Milwaukee Fatherhood Initiative, which you'll hear more about in a couple of minutes. But this study is aiming to explore the ways that the stresses and uncertainty posed by the pandemic compound existing pressures that were already experienced by low income and non-custodial fathers. So existing economic instability and family pressures. We've been doing surveys and focus groups with fathers who are participants of programs of the Milwaukee Fatherhood Initiative and other father-serving organizations in Milwaukee, learning about some of the challenges that they have faced during the pandemic related to parenting and co-parenting, as well as work and finances and so on. And so this is ongoing, but I'm going to present some very preliminary results. Some of the themes from our qualitative data from the focus groups. We've been hearing about extensive losses of family and community members. And I really want to contrast this to what I said before. In the first study, people talked about losses, but the difference is really profound. With this population, in the study with fathers with low income and non-custodial fathers, the losses are just tremendous. So all of these focus groups are shaped by fathers talking about, well, over the last year and a half, I've lost so many people I love, people in my family, people in my community. And so everything that they're telling us about what parenting has been like and about what work has been like is unfolding in a context of such profound loss. Fathers also talked about employment disruptions and child support challenges. A theme that kind of cuts in both directions, with some fathers talking about how the pandemic brought us closer, me and my child, and somehow it made us more distant. In some cases where fathers had opportunity and access to spend time with their kids, they had extra time and quality time that they hadn't experienced before. And on the other hand, some fathers, particularly where the relationship is fraught with the child's mother, talked about how this just exacerbated distance that might have been growing before or existed before. It just became more distant. So some really stark differences there. Fathers talked about a new dimension to parenting and co-parenting, needing to navigate the pandemic with their child's mother and figure out when they had different beliefs or different things that they wanted to do around risk. A new recognition of the importance of their presence with their children, and I'll offer an example of that in a moment. And then also a lot of talk about isolation and trauma. So the importance of presence. One father says, prior to the pandemic, I was always working, like, some cases 50, 60 hours a week. One thing I learned through the pandemic, I have a 7-year-old, and like in the middle of the pandemic, when everything shut down, we were doing his at-home lessons, which aren't always easy. And he said something to me and it just really struck home. He was like, Dad, I'm so glad you're spending time with me now. And that was a really meaningful moment for this dad to realize he'd been working so hard and his child, it meant so much to have this time together. And he talked about how going forward, he wants to make sure he's prioritizing that time together. An example of making us more distant and also how this is complicated to navigate with co-parents. Well, for me, it's been distant, extremely distant because of the pandemic. The other parent was just nervous about like the company I was keeping. And so seeing my kids was like none and void. The relationship fell apart and, just been starting to work on building that back because we aren't together. She don't know, what I'm saying? And just, being nervous about what's going on. So the child's mother worrying about him being a source of risk of exposure to COVID and limiting contact with the child as a result. And then last quote I'm going to share with you today, an example of fathers talking about isolation and trauma. And one dad says, it's been hard because I think you don't have anybody to talk to or an outlet, so you keep everything internally. Being a father and a man, you have to keep the peace and be strong on the outside, but on the inside, you're falling apart. I'm sure that's going to have a lot of long-term effects because when you suppress trauma, it comes out in different ways. And a number of dads talked about this, just the profound impact of spending all of this time at home alone, of having, increased distance from kids, just the trauma of all the losses and how they worry about how that's going to play out over time. So last slide for me, and then I'm going to turn it over to Daryl in 1 minute here. I think some implications of this work in terms of what we can do to enhance support for fathers and families. One is paying attention to increasing support for those who entered parenthood during this exceptionally challenging time, recognizing that many have not had the support that they anticipated or needed, and we need to circle back and make sure they get it. That we need to be addressing needs for information, needs for social and emotional support for all parents, regardless of gender, so fathers as well as mothers, and regardless of residential status, that whether or not fathers are living in the home with their child or seeing their children part of the time visiting with their children, that all parents want information, want to know how to support their kids and have support for their relationships. Normalize a range of feelings and emotions related to parenting during a pandemic. Some parents are saying we feel closer. Some fathers are saying we feel more distant coming out of the pandemic. Actively encourage father involvement in prenatal and pediatric care and in children's schooling. Fathers talk about how meaningful that is to them. And then work with all parents, work with fathers as well as other parents in considering pandemic incurred practices that they want to maintain and practices that they want to disrupt. So maybe they got in the habit of not going to the visits because only one parent was allowed to go and mom was going. When that opportunity opens up again, supporting them to make a change so that that doesn't become an entrenched habit over time. With that, I'm going to turn it over to Daryl Davidson of the Milwaukee Fatherhood Initiative. Thank you so much, Daryl.
Thank you, Tova. And welcome, everyone. I want to start off by giving you a background on our Milwaukee Fatherhood Initiative, which was started in 2005 with numerous entities from the greater Milwaukee community, including our grant giving and philanthropic sector, our business sector, and also with a chief push from our fatherhood organizations that existed at the time, as well as our Milwaukee Mayor's Office and Milwaukee County. We did, from the beginning, want to make sure that this was an office of engagement, not just for fathers, but also for the supporting organizations. So when I give my information, I want to ensure that it's not that every single thing is going to match what's going on in your community. We have a huge amount of support from our government organizations, and we also have a long history of how we've been able to work together as a collaborative. We even have a 16-year going on effort called the Milwaukee Fatherhood Summit, which builds between those organizations and establishes us as a one-stop shop over a 2-day period. And we were able to do that for the first time in over a year now that the pandemic has changed its focus. I do want to also say that in our area, it's the Milwaukee County Office of Child Support Services that is the recipient of the Family-Focused, Interconnected, Resilient, and Essential grant from the United States Department of Health and Human Services. So with that being said, we also want everyone to remember that there is a focus on healthy relationships, responsible parenting, economic stability that is being driven from our Milwaukee Child Support Services office. So they're not necessarily seen as an entity that is going against what we're trying to do in our greater Milwaukee area also. And ultimately, our Milwaukee Fatherhood Initiative as an organization receives clients from a variety of sources. That could include Milwaukee County Corrections, behavioral health. We have group education that comes from our classes that are related to the curricula that we use, as well as we have general community education classes that run just about every month. And that has changed as far as doing it in person versus virtual, but we still are conducting them. So next slide, please. I do also want to say that our primary client identity would be male, as well as generally it is a male of color, about 80%, with the large majority of them being African Americans. And during the pandemic, there was a rise in phone discussions around what types of fatherhood activities and father groups were available for supporting what they needed. This didn't necessarily say to us that they wanted to declare that they wanted to be a client or needed services, but it was a commentary that they were spending more time with their children during the pandemic. So during this period, it's starting after March of 2020, Milwaukee Fatherhood Initiative received more calls from both mothers and fathers. Next slide. And for the person who asked the question, we are using a variety of curricula, and I will type that in the chat. But we definitely are using the Nurturing Fathers curriculum for most of our classes. We also use Inside Out Dad for some of our clients, and I'll move on. Men reported taking on more activity around the clock related to childcare. And I want to emphasize that it's not that the men did more than the women during childcare, but they did seem to have more responsibility that increased. It seemed threefold. They were doing more things outside the house related to childcare and inside the house related to childcare. And when we were also asking them questions about the children's education, they were letting us know that they were deeply involved in the child's education, especially when their children had begun their virtual learning activity and sometimes had trouble with using the computer. This is at every age of the spectrum that the fathers were involved in. They wanted more questions around first aid and safety, online income also, and discussing what it means to be a dad. The online income question came about because many of our fathers are considered to be essential workers in terms of they are working in food service, or many of them are working in industry that had to provide something that was necessary for grocery stores, as well as in the creation of water and other essential activity. And also some were involved in home health care. So they wanted to find out ways of negotiating with their employer on how they could spend more time with their children now their children were at home more, whether they were the custodial parent or not. And they also had a big concern about work-life balance, especially now. Earlier, they didn't really consider it. So prior to the pandemic, not as much thought around it. It was more about making money. But now the importance of work-life balance, because in some cases, the fathers were able to get a part-time job associated with the activities that were related to their full-time employment, or they were able to work overtime because there were some people who were not working. They also wanted to know about websites for safe activities or events related to children. Now, in the past, the big promoter of our safe activities for children included the Milwaukee Public Library. So many of the activities now that we're going outside had to be extremely creative. We'll go to the next slide. Now, the women who were asking about the fatherhood services primarily were asking what father services were available. Most of the time, that was not our traditional call. And many inquired about transportation, social services, and stating that they were on hold with other resources. So the general help centers and organizations that they typically would have called, those lines were either busy or they were going into voicemail. And because many of the services that they needed were extremely timely, they called us because we were answering our phones, as well as it did make sense that we work with both parents. The other thing that they were concerned about was behavior changes in children, especially related to homeschooling. The children were often reported not getting along with siblings, or there was the environment where they were not able to space themselves and they were in two different grades or two different age cohorts, so that they could not actively learn in the environment if they were in close proximity to each other. The other thing that I want to add is that what we were learning specifically for our Milwaukee clients who were calling, that many of the women were reporting that they had lost their jobs. Some of them were involved in childcare themselves, and with the childcare centers shutting down during the lockdown, some of them did not have access to income during that period. And so they may have had to rely on income from a partner who was outside the home that they traditionally would not have had to rely on as much. Next slide, please. As far as it goes with the relationships and the questions and answers, this is related to primarily the adults, but also with the children. The fathers did increase their discussions around homework and schoolwork and where they could get assistance and how they could get information about performance, school performance with their children. Our school system did have access to report cards and school performance, but they were not always easily accessed because sometimes the parent would receive the information in an email on how they would have to log in or how they would have to introduce themselves. And some of that information went to just one parent. So if the parents were not communicating, one parent had information on how to access their child's school performance, the other parent did not. Because there was a decrease in hours, as well as in some cases, there was the loss of a job, there was an increase in the discussion about the fathers with discussions about future career decisions regarding what their child wanted to be when they graduated from high school, or what type of future decisions they were going to do related to their family now that the income had diminished. Non-custodial fathers who had no relationship with the court system also expressed desire to introduce their case to family court. The Milwaukee Fatherhood Initiative did assist them with filling out the paperwork. The reality is that, yes, family court, it does take a long time generally, but because that also shut down during the lockdown period, with the exception of if there was a very urgent situation, perhaps if there was violence attached to it, then they would address that particular case. But many of the fathers had worked out relationships with the moms on how they were going to have relationships with the children and did not want to bring the court system at all. However, if they were working in an environment where now they were considered an essential worker and the mom had a child placement order that now the father was seeing as it was being exploited, they were, for example, the father did not see the children as much, primarily because the mother was making a decision saying that if you're working in this particular work environment, I don't trust the safety or the health of our children if you're coming in close contact with them or if they're spending time at your home. So therefore, the fathers had many other questions related to how can they get the opportunity to see their children more versus less in a case like this. The fathers also noted that they saw more information about domestic violence, but less information about positively engaging with their children. Next slide. So I finally want to talk about the avenues for fathers to state that they needed flexible work practices. They wanted to introduce that information to their employers, as well as redefine for themselves how men are perceived as breadwinners, or how they're perceived as or valued as the head of a household. They wanted a different identity connected with that. And since they had more time with their children, they wanted a stronger bonding relationship with their children. So this was an opportunity to promote discussion about the shared caregiver roles between the men and women, especially with the non-custodial fathers who readily could not access this family court system. I'll turn it over to Tova, and if you have any questions, I'd be happy to answer during this presentation.
Thank you so much, Daryl. So I'm going to invite Derek now to come on, and he's going to be speaking to us about his work in Kalamazoo County. Thank you, Derek.
Hello, and thank you, Tova. Thank you, Daryl, for everything that you've shared with us today. And I just want to give a brief background on the For Dad Fatherhood program in Kalamazoo County before I get into some of the slides. So the For Dad Fatherhood program really came out of a grassroots movement here in Kalamazoo. Myself and about 4 other dads were all going through our own parenting journeys. And, you know, I'm in the hospital. My wife had our first son, and, you know, he had to spend some time in NICU. I was in there for a good month and a half. And while we're in there, I saw all of these programs and services rush to her, and I'm glad that they did. I'm glad that she was feeling supported. But then I'm looking around the room, and there's no one there for me. And as I said, there were other fathers that were going through something similar. So seeing this gap, we did focus groups around town, and we proved that fatherhood programming was wanted and needed in Kalamazoo. We partnered up with another local program, Healthy Babies, Healthy Start, and they helped us to write a grant. That grant was approved through United Way, and now here I am. So what I do is I meet with dads and I talk to them about the development of their children from the time that their partner is pregnant until the child gets to 18 months or 2 years old. And I help to educate them on the milestones of that child and all the things that that child will go through and how they as a father uniquely contribute to that child's development. So with the slides that I'm going to be going through is a collection of some of their experiences and everything through this pandemic. Go to the next slide, please. So the areas of focus, and some of this is going to echo some of the information that you've already heard or listened to before. But I want to focus in on parenting time, housing, and prenatal visits. Next slide. So parenting time. As you've heard before, this parenting time, for some of the fathers and everything that I've worked with, they saw that or felt that COVID-19 was being used as an excuse at times to keep the child away from them. And other times the child or the mother of the child was exposed to COVID-19. And with the 2-week quarantine, you know, that just throws the complete chart of parenting times all the way off. Okay, let me do this. Is that better? Okay. So the 2-week quarantine would throw parenting times completely off, and they would have to make up new schedules or try to find some other way to connect with their children, as well as the changes in work, daycare, and school schedules. For example, many of the daycares in town with the pandemic and everything, they changed their schedules, and this is even after things started to calm down. This isn't the height of the pandemic, so they changed their schedules to children need to be dropped off at 8:30 and picked up at 4. But it's like, wait a minute, this father still has to work 9 to 5. So with this kind of change, they had to find either somebody to come pick up their child, or they needed to negotiate with their employer to have a more flexible schedule so that they could accommodate this new schedule for their child. Parenting time, the experience that fathers had wildly relied on how much access to resources they had before the pandemic hit. Those that did not have a lot of resources, they had to find a way to pivot, but it was significantly more difficult during this time. Next slide, please. And now housing. Housing is, I'm sure, is a great issue for many, not unique to Kalamazoo, but in Kalamazoo, there's very limited housing for men and their families. There is emergency shelters. They will allow women and children and men, but again, the women and children will be separated from the men. And the main facility for that in town has been and still is full to capacity till this day. But the need for housing, and emergency housing at that, was too great. There's access of families that needed emergency housing, whether it be losing an apartment because of lost their job, they got laid off, couldn't keep those payments up, or what have you. So some of the fathers that I worked with, what they would choose to do, they would let their wife, girlfriend, partner, and their children go into a shelter or go live with a family member elsewhere. And this participant in particular would choose to stay and live in their car. They were able to find part-time housing, but with that, they just had to save money in order to try to find another option. Also, as you can see that I have on the slide, apartments at the height of the pandemic were not accepting new tenants because they did not want someone to come in with COVID-19. One of the remedies that I did with the program, I knew a lot of private landlords, and had to try to connect these participants with them so that they could have a kind of a warm handoff, if you will, so that they would know these fathers and kind of give them a chance as far as getting into some stable housing. Can I go to the next slide? Now, prenatal visits. As echoed before, beginning of the pandemic, many of the fathers were not allowed to attend these prenatal visits or to come in or to even attend the child's birth at times. This led to a feeling of isolation. Statistically speaking, we know that if a father is more involved during pregnancy and the first 2 years of life, as they are more likely to stay involved with that child for the remainder of their life. This kind of feeling of not being able to be there, it made fathers kind of distant when it came to their child and everything once they were born. Many fathers felt like they were just ill prepared, especially the new fathers, because all of this information was being given to the mom, but some things get lost in translation as far as getting back to the father. Some things that we were trying to do with this aspect was to try to empower fathers to try to be there in another way. When the mom is going into the prenatal visits, try to write down your questions and send the questions with mom. Try to provide as much information on what would be going on during the prenatal visits and what would be going on during the child's birth, so that they could have some information. But with this, I'm gonna come to a close. I see Tova about to kick me off, but yeah.
No, take a minute to wrap up. If you would like, feel free to take a minute to wrap up, Derek.
Yeah, it's with all of these different stories, we tried to find different workarounds. We tried to find creative ways to bring the that kind of involved and birthing experience to the fathers, but it definitely was a huge obstacle to overcome due to the pandemic.
Great. Well, thank you so much, Derek. And when we get into discussion, I'd love to come back to that and hear some more about the workarounds that you came up with. I think others here who provide services to dads might be interested. So thank you so much.
Yep.
With that, I'm going to invite Shauna to come on and we'll hear from you now, Shauna. Thanks so much.
Great, thank you. Thank you, Tova and Dave, and to the University of Wisconsin Institute for Research on Policy for the opportunity to talk to you all today. I'm going to focus on supporting fathers during COVID-19, particularly as it relates to mental health. Next slide, please. And what we know from the pandemic, probably not surprising to too many people, is that levels of anxiety and depression during the pandemic were about 2 to 3 times higher than usual rates. So normally, depression and anxiety are fairly common experiences for the US adult population. About 19% of US adults will experience anxiety and about 7% will experience depression in a year. And the pandemic data suggested very high rates of anxiety and depression. Next slide. And some other studies also suggested that parents in particular were struggling with many of the issues that Daryl and Tova and Derek just spoke about: financial and food insecurity, managing childcare and work remotely, supporting their children's at-home education, and even children's experiences of increased behavioral and mental health problems. So next slide, please. So my research team and I really wanted to understand the experiences of mothers and fathers during the pandemic in terms of their mental health and their stress and their financial worries. So we created a survey that we launched online, Stress and Parenting During the Pandemic, in the first few months of the pandemic. So this is March and April of 2020. And so I'm going to talk about that data and then some additional analyses that we did looking at mental health among moms and dads during the pandemic using a much larger and much more robust sample from the US Census Household Pulse Survey, April through July of 2020. Next slide, please. So we hypothesized that parents would be struggling more than other adults and that we'd see higher levels of mental health problems and depression, anxiety. And we also looked at mothers and fathers' experiences. Our sample that my research lab and I collected was fairly small, about 683 people, 468 parents, not particularly diverse, 71% white, with 37% male, relatively high levels of education, but many people in the sample reported recent experiences with employment changes and other stressors related to the pandemic. Next slide, please. Apologies if I'm talking fast. I just want to make sure we have a robust Q&A period. And so what the data from my survey showed, again, March and April of 2020, less than 2 weeks after the World Health Organization announced the coronavirus pandemic, was perhaps, again, not surprising, anxiety and depression were very high in our sample during this time period. Between 30 to 38% of respondents met the criteria for generalized anxiety disorder, a probable generalized anxiety disorder, and about a similar number met the criteria for probable depression, and worries about financial concerns were very high. Next slide, please. But, and so then we looked further into the experiences of parents versus non-parents and mothers and fathers. And what our analyses just suggested was that anxiety was higher for parents compared to non-parents, but no differences in depression. And parents had higher levels of financial worries. So this really does confirm and speak to the data and the experiences of Daryl and Derek and Tova in working with parents and doing focus groups with parents. Our results really echoed those concerns. Interestingly, though, we didn't find that mothers or fathers were higher than each other. In other words, parents overall were reporting similar levels of concerns about anxiety and financial worries. Next slide, please. And we did some small amount of open-ended questions in this survey. And I really like to highlight that even though stress and anxiety were very high among our sample of parents, just like Daryl and Derek and Tova said, we saw a lot of parents talking about the amazing benefits and the exciting opportunity to spend more time with their children. So here are some quotes from some open-ended questions. These are just from the dads in our sample talking about how they felt closer to their children. They haven't been working, so they've been doing more fun things like planting a garden, watching TV shows with their child, and really viewing this time as a blessing despite the challenges. So that's a message I hope we can return to in the Q&A. And next slide. Helped you during the pandemic? Parents, fathers, again, these are based on the responses from fathers, talked about, being supported to some degree at work, making lifestyle changes to help them connect to their kids. And then some of the challenges that related to having everything closed down. Next slide, please. Oh, oops, is that? Yeah, thank you. How has your parenting changed? So what's different now compared to what it was like before the pandemic? We had some really nice quotes from dads talking about how they feel more aware of their children's concerns and their children's stress levels. They're working harder to find creative solutions to wear their toddler out since they can't go to the park. They're spending more time educating their daughter and trying to come up with fun activities. They feel more tired, not surprisingly, and trying to be more patient and more open-minded. So again, I really feel like there's a balance here of some of the challenges as well as some of the amazing opportunities and things that parents and dads are learning from this time. Next slide. We also asked a really interesting question about challenges related to being criticized for your parenting. As every parent knows, we didn't get a lot of guidance in the early days of the pandemic about what to do and what was safe. We didn't have information, we didn't have data. And so there was a lot of conflicting ideas and behaviors, and parents were criticized for whatever choices they made. That's what our data showed when we looked at it. People were criticized for keeping their children in quarantine, and they were criticized for letting them not be in quarantine and be out with friends or family members. So we really saw that being a parent was challenging, and disapproval was a common experience for both mothers and fathers. Next slide. And we did some quantitative analysis looking at the criticism of parenting, comparing mothers and fathers. And in our data, in our survey, mothers reported experiencing more criticism overall about their parenting choices compared to fathers. However, interestingly, when we looked at outcomes related to that, we found that criticism of parenting choices was associated with more anxiety and depression only for fathers, not for mothers. So very interesting pattern of finding. And we kind of concluded that criticism of parenting, especially during a challenging and uncertain time, may have a stronger effect on fathers. Maybe we can, talk about why that could be, but possibly fathers are just less experienced receiving that kind of criticism, and thus it had a more detrimental effect on their health and well-being. That's one possible explanation. All right, next slide. And lastly, I'll quickly talk about our analyses with the census data. So next slide. Very big sample here, obviously much bigger than my small survey, 592,000 households. Similar rates of anxiety and depression, 35% met the criteria for anxiety, 24% for depression. Next slide. And we compared caregivers versus non-caregivers on anxiety and depression, similar to the first study, and found that actually with this much larger sample of Americans, caregiver status was not associated with meeting the anxiety criteria that I mentioned earlier. And actually being a caregiver compared to being a non-caregiver was associated with decreased likelihood of depression. This is something I'll talk about a little bit more as to what that could mean. Being male was actually associated with overall lower levels of anxiety and depression that was similar to pre-pandemic. Women generally report more mental health concerns than men. Next slide. So when we looked at mothers versus fathers, we found that caregiver status was a very small protective factor for females, but a very small risk factor. The differences were very tiny, but there was a little bit of evidence that when we disaggregated that effect, that fathers were a bit more anxious than mothers. And that could be linked to the financial concerns that we measured in the first study. We found that depression, that caregiver status was moderately protective for both females, mothers, and for fathers. And in fact, in my research looking into this further, it seems like data from the pandemic is showing that people who live with children overall are not doing worse than the rest of the US population. The people who are really struggling and were struggling initially were the people who lived alone. In other words, single adult households really struggled with the social isolation aspects and had the highest rates of anxiety and depression. Next slide. So a few concluding points. First, when we take it all together, what we see is that anxiety and depression and financial worries were really very high across the US population. So although we didn't seem to find that parents or caregivers were doing a lot worse, everybody is struggling. Maybe this is helpful in terms of normalizing the experiences of being depressed and anxious in a stressful time. We also found that fathers might be a little bit more vulnerable to anxiety and possibly also to being criticized for their parenting choices. And overall, caregiving status may in fact be a little bit protective. So having someone else in your household, even a child who might be a little bit causing you a little bit of stress from time to time, may actually be a buffer against the social isolation. So hopefully also we can talk about the strengths that families demonstrated in terms of the benefits they got out of spending more time with their kids during that lockdown period. And with that, the last slide is just my lab website, parentingincontext.org. Thank you.
Thanks so much, Shauna. So we're going to move into some questions and discussion now. So I'll invite Derek and Daryl to turn your cameras back on so everyone can see all of us as we have some conversation. And one thing I just want to point out before we fully go into our discussion is just the link here. I want to acknowledge that many of these photos come from the Alameda County Father Corps' Diversity of Fatherhood Photo Bank, which is a terrific resource for really stunning photos of fathers and their children. So anyway, we appreciate that, and some of you might be interested in it for your materials. So we're going to move into some discussion now. And, I want to just pick up on something Shauna just said and then kind of turn it to Derek and Daryl to hear your thoughts. You were mentioning, Shauna, at the end how, single adults actually were struggling even more with the social isolation. And one thing that I heard in focus groups was from fathers who don't live with their kids, but who see them or don't live with them full time. It was almost like it felt like to them like the worst of both worlds. Like they were so lonely. They had this isolation, being home on their own, and also all the worries about their children. They just weren't able to have that time with their children that people would who are living at home with the kids. I'm wondering, kind of what what you've been hearing, kind of what your thoughts are, the kind of support you've been able to offer that's been meaningful for dads who are not with their children full time, but are worrying about them and trying to navigate all the complexities of co-parenting during a pandemic.
Did you want me to answer that, or Derek or Daryl?
Okay. Maybe.
I think you went on mute.
I'm sorry about that. I'm going to invite you to start, Daryl. I know you've had a lot of conversation with dads who are not full time with their kids, and Derek, if you want to chime in as well. Okay.
Yes, and thank you for bringing that up, Shauna, because the reality is that fathers were reporting isolation prior to the pandemic. Often, if they were a stay-at-home dad, they were taking the child to the library or to the park. Sometimes they were the only father in that environment. So that was isolation, as well as it also caused some friction in the conversations that they might have had with their partner or with the child's mother. But what I will say is that the social isolation seems to be a big deal until the fathers get involved with the support group activities. So there are curricula that exist right now where the support groups are built into it, but also in the Milwaukee area, we host the Real Men Real Talk activity, which is hosted in person in a barbershop environment, but it's also an online version of that where we can do it virtually. And so we have pockets of fathers who may be experienced, some who have graduated from our fatherhood courses, as well as experienced fathers and grandfathers who are able to talk to fathers at different stages of that spectrum. So that's been helpful too. And it also removes the stigma of the fathers talking to um, fathers who don't know anything, which seems to be a problem and almost a stereotype where every father who's asking questions doesn't know where to get answers. There are people who are experienced fathers who have graduated from our programs who do have answers, and we want to make sure that they get connected.
Derek, do you want to add some thoughts about kind of what you've been seeing in terms of isolation and also some of those workarounds you mentioned, like what's been effective for helping fathers during a time that's been so isolating?
Yeah, definitely. So one of the things that we did even before the pandemic, we had what was called discussions with dad. That was an opportunity for those in the community to come together to support each other. I would have men who weren't fathers yet, but were thinking about becoming fathers, would have new fathers, would have grandfathers, would have guardians, all coming together, and it would be a space. We had a Vegas vibe where what is shared there stays there. And it allowed it to be a safe space to really share your thoughts, fears, or concerns about any subject around fatherhood or just life in general. When the pandemic shut everything down, we were able to successfully move this into an online format via Zoom. So we did this every week. Had these, I would send out the links to the dads. We would go through 24/7 dad curriculum and really use that as a guide, especially in the online format, because there was so much that dads were going through that did not want it to be a super formal environment. Wanted to allow space for the dads to share out and everything. But we would go through the 24/7 dad curriculum. We would dive deep into concerns that any of the fathers would have. And we would thank the dads that would join the conversations and everything online. We would send them a gift card. It could be a little something like a Grubhub gift card or gas card or something like that, whichever they preferred, just as a thank you for participating. And the dads that participated, they said that it was like an intense therapy session where they could just get things off of their chest and be able to talk to another adult and not be so isolated.
Yeah, thank you. So one question, I'm going to steer us in a slightly different direction. Just one of the questions that came up from a number of people who registered for the webinar that we haven't touched on yet that I want to bring out and invite any of the panelists to comment on was some questions about fathers who either experienced incarceration during the pandemic or who are reuniting with their families at this time. If there's anything that any of you are seeing in your work around how fathers who are in reentry might be experiencing things during the pandemic and support that they might need. What kind of supports are meaningful for fathers and families right now? Daryl, do you want to start with that one?
Yes. So the Milwaukee Fatherhood Initiative has resources that are partnered with us consistently, and we are also bringing them under the same roof in 2022. One of those is the Milwaukee Justice Center, which has a relationship with the Marquette University College of Law. We have worked with them in cases related to identifying if the fathers have an opportunity to receive a pardon or go through the expungement process here in the state if they have not don't have a violent offense. If they are incarcerated, we do host classes at our Milwaukee County House of Corrections. As a matter of fact, one of those courses is being offered today. We do the curricula as well as Inside Out Dad, and we are promoting fathers communicating so that they're able to reestablish their connections and their bonds outside of the incarceration. And when they go back into their family environment, for the most part, the family wants them there. And so we want to be able to establish as many options that they have available to them for problem solving. So that's the skills for problem solving, as well as the agencies that can assist them that we are going to refer them to, including our Milwaukee County Behavioral Services Division. So there are resources here locally.
Yeah, Derek, is any of your work with fathers who have been incarcerated? Do you have any thoughts you want to add on that topic? Or
with fathers that have been incarcerated, I mainly work with a lot of fathers that are freshly getting out of prison, and those involved with drug court. So I've been able to work with them, being able to go through different curriculums to help get parenting time or increase parenting time, or to meet whatever kind of goal that was set in front of them. So I have been able to use things like Inside Out Dad and talking with them, and really just connecting them with community resources so that they can enter a stable environment and really dive into fatherhood as they want to.
thank you. I see a lot of great resource sharing happening in the chat, so that is terrific. And I see one question that maybe I'll start with you for this one, Shauna. There's a question about, what in your programs, and I think this could apply to research too, what are you hearing from dads is kind of their greatest need for support for helping them to be part of their kids' lives? And I wonder if you have a sense from your research, Shauna, and then maybe Derek and Daryl, you could say too, what are the greatest needs that fathers are reporting?
We didn't address this in this particular set of studies, but in my experience, one of the biggest needs is income and economic supports. It's pretty much echoed consistently through the fatherhood research, is a barrier to a lot of fathers with low income, and it's just has not been adequately addressed by our current policies. People like Derek and Daryl are doing an amazing job, but we need better policies and supports, child support, revisions to those policies, more economic supports to families and fathers with low income. In my humble opinion, that's one theme I hear a lot and see a lot in the literature.
And
thank you, Daryl.
And we also are having numerous discussions around family court and child support as far as it being punitive. And what many of the fathers are sharing with us is that they are providing supports for their children in a variety of ways that may not necessarily be financial, especially during the pandemic when some of them were relieved of their full-time duties and became part-time workers. And so if the courts were closed, they were not able to have any adjustments on what was being ordered from the courts. And therefore, that became part of a financial discussion that it seemed to be a huge hurdle with them. So that's large, as well as finding a way to still meet with their children, raise their children in an environment when they're back at work and maybe are becoming full-time, and the relationship with their children is stronger because during the pandemic, they had more time with them and they were able to explore what their needs were outside of being a breadwinner. And therefore, they want to know if their employer can assist them with adjusting their hours or finding ways of working at home if that's possible.
Dave, I see you coming on here, so I think we're at the end of our hour. Am I right?
We are about at the end of our hour. So I'm so grateful for the four of you taking the time to present here and for just this great discussion that we've had. But before we go, I want to give each of our presenters just an opportunity to kind of offer sort of a wrap-up thought. You know, what do you want to leave us with, and what sort of things are, you know, maybe especially you're paying attention to as whatever sort of this next step we're seeing in this pandemic, you know, what are some of the factors that you think might be affecting fathers, especially in the months ahead here? So, Daryl, would you be willing to start us off there?
Yes, I think that one thing we should take a look at is now that we've experienced this, we're not going back to what things used to be. And many of the fathers are open to the idea of using technology so that they can work with the various services, systems, and access to their children. We just had a Milwaukee Fatherhood Summit again this year, but the Saturday version of it for the first time was virtual, and it was a huge hit. And I'm very happy that it was successful because many of the fathers that attended said that they want to see it again. So I would encourage people to start looking at alternate ways of communicating with the fathers regularly and get creative because they do want to be with their children.
Shauna, would you go next for us?
I'm going to end by giving a shout out to Derek Miller, who I've had the chance to work with for many years. And he is amazing at his job in the Healthy Start Fatherhood program. So I just wish there were more programs like that. And I love working with them and supporting them in their work. So.
Absolutely. It's so great to hear about just kind of the amazing things you've been able to do there, Derek. But Derek, I mean, what do you want to leave us with?
Really want to echo Daryl. Try to engage the father as much as you can whenever you can, not just when he's in your space. Send information, send encouragement, and really kind of get outside of your comfort zone when trying to engage them. Many of the dads that I work with, I wouldn't get anything out of them until they started to trust me. That's me coming through with everything that I say and really just being there totally to help them. So yeah, engage the father whenever you can, look him in his eye, ask him how his day is, and yeah, just do what you can for him as much as you would for mom.
Okay. And Tova, I'm going to turn to you next. And I just want to, before I do that, just acknowledge that you've been kind of the organizing force behind this webinar. And so we just especially want to offer you a thank you to you. So what do you want to kind of close us out with today?
Yeah, thank you so much. Well, it is a delight to get to present with Derek and Daryl and Shauna, whose work I admire so much. And Daryl, you're getting shout outs in the chat for the Fatherhood Summit. So I think it was a great experience for everyone who was there. But you know, as a final thought, I think I want to come back to something that's been a theme throughout what we've been talking about, which is that, you know, there were some positive changes for some fathers that came out of this pandemic in terms of ways of spending time with their kids that they hadn't experienced before, or ways of engaging with services that they hadn't before, that dads really value. So I want us, you know, when we think about the future, to think about how we hold on to those things and support it, you know, as things, you know, go back to normal in some kind of way, or fathers have less flexibility with their schedules and with working from home and so on. How do we preserve that quality time that has meant so much to dads throughout the pandemic? And on the flip side, thinking about things that, you know, were negative impacts. Derek talked a lot about, you know, what you saw from those new dads who got left out of an experience they wanted to have in prenatal care. You know, how do we make sure to offer them opportunities to get connected that they missed out on, and not let that be, you know, something that lingers for them, that we kind of can be intentional about inviting them into pediatric care, inviting them into your programming with fathers, but not letting them get left behind because the timing of their baby being born coincided with the pandemic. So just thinking about those, you know, flip sides of things to hold on to and things that we want to course correct.
Awesome. Again, I just want to thank all of you so much, Tova, Daryl, Derek, and Shauna. I just so appreciate the four of you taking the time to do this and to share the awesome work that you're doing. As a reminder, we've mentioned this in the chat, but we are going to send out the recording and some of the slides, and I'll have those out to everyone that registered by tomorrow. So you can look forward to that in your email. And of course, you're always welcome to share those with your colleagues who this might be helpful for. So again, to our presenters and everyone that joined us today, thank you so much, and have a great rest of your afternoon.